With respect to reactions, drug reactions, you just mentioned that there are options like this available. But for patients who have really faced acute side effects, like in my case with steroids, I remember after my cataract surgery, I was like emotionally battered, and I remember meeting you. I didn't have a very good relationship with steroids then because I really saw it taking on my case. That's when you told me something that changed my relationship with steroids. You said that steroids is required to keep you alive, and the side effects are something we can tackle.
Yes, yes. As I said earlier, somebody comes with seizures. You must have seen a couple of patients when you come visit ward, somebody who is unconscious because lupus has affected their brain. There is no drug which can save that patient in an immediate aspect of 2 or 3 days other than steroids. So, steroids are very effective in the initial phase, and without that, that patient would not be alive. But it does not mean that there are some other set of patients who continue steroids without monitoring. For example, if they have something, they will take 15 milligram, 20 milligram, unmonitored they will continue at a higher dose. And there is somebody else who are not at all willing to take even 5 milligram of steroid, they will just stop it. So, there are 2 groups of patients. So, but ideally what we should do is basically take steroids only when it is necessary at a minimum dose. As I said, told you, 90% of the patients are able to stop steroids at the end of 6 months to 1 year. But there are very severe lupus patients who need to continue 2 milligram or very low dose of steroids or 4 milligram of steroids for a longer time, 2 or 3 or 4 years. But most of them, thankfully, steroids are being tapered and stopped. But during that time, it is necessary to keep somebody alive. So because if somebody who is unconscious, totally not able to talk, if you give steroids, yes, his sugars can go up, her sugars can go up for a temporary period. That can be managed with insulin. So they can develop a cataract. That can be operated at a later date. But if steroids are not given that during the appropriate time, he may not make 6 months or 1 year. He may not live next day. Sometimes he may die, he or she may die the next day. So that is, steroids are given only when it is absolutely necessary at minimum doses for a minimum period. It is not that lupus has, that is what I told you, with the improvement in immunology or treatment of autoimmune rheumatic diseases, there are a lot of new drugs which are available which can be given to these patients so that steroids can be stopped in due course of time.
On this note, I'd like to invite everyone for the Lupus Day event that's happening here at Kochi. There will also be a blended event that will be happening online. So we are hoping to have maximum participation from patients, their families and their friends and the support system. Thank you, Doctor.
Thank you.